We're here to stand up for the women of America who deserve to have access to free preventive care through their health insurance. Women in this country are tired of being treated like a political football by Republicans in Congress. It's medicine. To stop debilitating monthly cycles, to stop endometriosis, to avoid dangerous ovarian cysts. Some even use it to cure a severe skin condition.
Every time we hear it's not really an attack on women's health care, it's always about something else. We're told that attacks on abortion rights aren't an infringement on a woman's right to choose. It's really about states' rights or religion. Tell it to Sherry. She's an X-ray technician in California who works at a Catholic hospital. Shelley's job is no different than an X-ray technician at the hospital across town, but she could lose coverage just because of who her employer is and where she works. Attacks on women's rights never come without being disguised as something else. But I'll tell you what, all of us up here on this stage are not fooled, and the American people should not be either. This is a fight to protect the rights of millions of Americans who do use contraceptives, who believe that family planning is the right choice for them, and who don't deserve to have an extreme minority's ideology prevent them from getting the coverage they deserve.
The latest attack is coming from what I will call a male-oligarchy. It's a word I coined some years ago, 9 years ago, when there was another attempt to attack women's rights for their choice. Now they're trying to take away affordable birth control, which is basic health care for women in our country.
The power to decide whether or not to use contraception lies with a woman, not her boss. This rule respects the views of religious institutions and individual conscience and freedom. A strong exemption is included that allows churches and houses of worship to opt out of providing birth control. This is already the law of the land in 28 states in our country. This should not be a religious issue.
No one is required to use birth control. No institution is required to dispense it, simply to cover it. Men and any women who back them ought to simply take their hands off women's health care.
We will use every legislative tool at our disposal to protect the women of America. We've done it before. We will do it again.